Should therapy for autistic children be covered by health care?
That's what lawmakers are trying to decide. A bill called Clay's Law would require coverage. Fox 13's Nicole Hunter joins us now live from Spectrum Academy in North Salt Lake with more on the story. Nicole?
You know, the chief sponsor of this bill is Senator Howard Stevenson. He's a Republican for Draper, and basically what the law would say is it would require certain health care providers to cover $50,000 a year for therapy for autistic children up to the age of 9, and from ages 9 to 17 it would be $25,000. Well, Utah is number 3rd in the country for the number of autistic children, and for parents and faculty here at the Spectrum Academy, a special school for autistic children, you can only imagine how passionate they are that this bill be passed.
It affects everybody in the family at every minute of every day. It's a disability. It is not a behavior problem child or a child.
Autism is a spectrum disorder, meaning it affects children in different ways. Garrett, 9 years old, is a dinosaur expert. Gage, 16 years old, is making leaps and bounds with his reading skills.
That was perfect, dude. That was absolutely perfect.
Thank you.
Good
The
job.
autistic child's gifts and challenges seem to go unrecognized by health care.
Speech therapy, $150 an hour, OT therapy, ABA therapy. It was really beyond our budget.
Get away!
And then there's what can happen when you say no. For Max, 10 years old, this can be a common occurrence.
If I didn't get anything else out of my insurance except for that help, that would make my whole, I would rather pay full price for everything else and have him taken care of, because it disrupts, it affects everything we do, everywhere we go, every person we come in contact with.
And those that oppose the bill say that health care is already too costly, and something like this would fly in the face of trying to reduce the premiums. Also, not all providers would be required to carry the coverage. For example, Medicaid and CHIP would not. And only about 1/3 of Utahns would be eligible for the coverage, so they worry those who really need it might not have access to it. Also, insurance companies tend to argue that the treatment for autism may or may not be effective. Live in North Salt Lake, Nicole Hunter, Fox 13 News, Utah.
All right, thanks.